Hello everyone. This session will be about anatomy of liver and gallbladder and biliary system. By the end of this lecture, you will be able to describe anatomical feature of liver, biliary system, and gallbladder, and describe anatomical features of gallbladder, and also discuss some clinical correlations and describe the blood supply and nerve supply of the liver and gallbladder. Liver is the largest gland in the body. It lies in the upper part of the abdominal cavity below the diaphragm. It is gland. The liver has four lobes. It have a right lobe, left lobe, quadrate lobe, and caudate lobe. The function of liver itself is secretion of bile and plasma protein, and detoxification of drug, metabolism of fat, protein, and carbohydrate, and also storage of vitamin A. Here we can see very clearly the right and left lobe of the liver, and D is also for diaphragm on the right picture on the screen, and is also for the stomach, and also there is a transverse colon and small intestine. And here in the left picture of the screen, this is a falciform ligament, and so also liver is appear here, the left lobe of the liver, stomach, and the greater omentum or the policeman of the abdomen. Liver surface. Liver has a diaphragmatic surface. It's related to the diaphragm, lung, pleura, heart, and pericardium above the diaphragm. It also has anterior surface. It's related to the anterior abdominal wall and diaphragm. The posterior surface of the liver is also related to the diaphragm. The visceral surface is related to the right kidney, right suprarenal gland, first part of duodenum, gallbladder, and transverse colon, and also fundus of the stomach. The right surface is related to the 7 intercostal space to the 11 ribs. Here, this is the left lobe of the liver, and you can see the falciform ligament containing the ligamentum teres or hepatis, which is the remnant of the left umbilical vein in embryonic region. Here is also falciform ligament again, and also the round ligament. Here, falciform ligament containing the ligamentum teres, and also appearing here the coronary ligaments, right and left coronary ligaments, and also gallbladder, the fundus of the gallbladder. Here the visceral surface or the diaphragmatic first surface of the liver. We have right and left triangular ligament. There is a bare area of the liver. The inferior vena cava also is appear here, part of transverse colon and the stomach. In this picture here, this is the visceral surface of the liver. We have this left lobe. We have S for the stomach impression, and this is impression for transverse colon, and here falciform ligament, and this is the peritoneum, and here is the bare area of the liver, that area devoid of peritoneum, and also the gallbladder. In the right lobe we have this impression for the right kidney and right suprarenal gland, and also impression for duodenal impression. And this is a hepatic veins. We have 3 hepatic veins that drain into the inferior vena cava, and between the inferior vena cava and ligamentum venosum, this is a caudate lobe, and between the gallbladder and falciform ligament or ligamentum teres, this is a quadrate lobe. Okay, you're supposed to memorize this one, very important. Between the gallbladder and ligamentum teres, this is the quadrate lobe, and between the inferior vena cava and ligamentum venosum, this is a caudate lobe. This all four structures forming the H shape of the liver, and here this is a porta hepatis. It's contained the portal triad. This is the H shape of the liver. It's formed by inferior vena cava above and gallbladder, ligamentum venosum, and ligamentum teres. This is about the visual surface of the liver. This picture here, the purple line is an anatomical division of the liver into right and left two loop anatomical lobes, and the green line, this is a surgical or functional division of the liver into right and left two portal lobes. Hepatic veins, they are three in numbers and they drain into the inferior vena cava. And this is a portal triad which is contained bile duct, portal vein, and hepatic artery. Here is the lesser omentum that join the lesser cleavage of the stomach to the inferior surface of the liver, and the appearing here is the kidney and the stomach and also gallbladder. This opening is called omental foramen or oviloic foramen. It is anterior part when we are entering our fingers. Here is very important clinically during surgery of the gallbladder, and enter your finger and to block to the inferior vena cava and here porta hepatis, these sides, and this is called Pringle's maneuver when you entering your fingers in this area into this epiglottic foramen or omental foramen. Anteriorly you will find the porta hepatis, inferiorly you will find the second part of the duodenum, first part of the duodenum, posteriorly the inferior vena cava, and superiorly the inferior surface of the liver. This is the omental foramen or epiglottic foramen. This is the greater omentum. Here is the gallbladder, and here's the celiac trunk. It's branching into the hepatic artery, common hepatic artery, and to the hepatic artery proper, and with the bile duct and portal vein behind them. To the left you will find the hepatic artery, to the right you will find the bile duct, and posteriorly the portal vein. This is the arrangement of the porta hepatis, the portal triad. Blood supply of the liver is supplied by hepatic artery 70% to 30%, and hepatic vein it's 70%. Sorry. Nerve supply to the liver sympathetically it's come from the T3, T7, T8, and T9, and parasympathetic it's by vagus nerve. Biliary system starts from the liver. Inside we have right and left hepatic ducts, then come the common hepatic duct. It's joined by cystic ducts formed by common bile duct, and the common bile itself is joined to the common pancreatic duct and to come into open to the major duodenal belly and form the ampulla of water and guarding by sphincter of Oddi. Let us talk about briefly about gallbladder. Gallbladder is lies below the liver surface, and its function to store and concentrate the bile. It has fundus body and neck. It's supplied by cystic arteries, a branch of the right hepatic artery proper, and nerve supplies come with the liver, and when there is pain it's referred to and radiate to the epigastric region and to the tip of the right shoulder and to the subscapular region. This is a hepatopancreatic duct system. This we have right and left hepatic duct is formed common hepatic duct, and then joined by cystic duct to form common bile duct. Common bile itself is joined by pancreatic duct to form ampulla of water, which open into the major duodenal belly, guarding by sphincter of Oddi in the second part of the duodenum. Here, this is a picture showing that the stone can be formed inside the gallbladder and also can go down and block to the ampulla of water, and even can pass through the pancreas and cause pancreatitis, block the pancreatic duct. Here is the gallbladder, and here's the celiac trunk, branching into the hepatic artery, common hepatic artery, and to the hepatic artery proper, and with the bile duct and portal vein behind them. To the left you will find the hepatic artery, to the right you will find the